चाललं त्याची खेळायला. ते खेळणं कॉम्प्युटरचं. So dear friends, we were continuing with our session. There was little bit some problem. We were discussing regarding the second case, and we have discussed what should be the diet of the person in order to reduce the weight. And the diet is very specific, which you have to mention. I generally ask the patient to follow the diet. If they follow it proper. Hello, are you getting my voice? So
Yes, sir.
Yes, sir.
okay. This is diet for weight reduction, and these are the factors which should be avoided. 100% you have to avoid, and this is what you have to tell the patient. Yes, they should avoid all those food items. If they avoid these, then definitely weight reduction. Every 15 days, 2 kg weight reduction happens to be there. And whenever the edema is associated, that edema also disappears once you ask the patient to reduce the weight. It becomes too simple to manage the case. I have done the same thing. And this fellow, this patient, she followed it 100%. She reduced every month 5 kg. And she was very nicely settled with the remedy. Remedy was very simple. I have given the Bryonia 10M. Please keep your phones mute. Hello. Bryonia 10M. I have utilized Bryonia 10M in high potency. Whenever you want a result more at deeper structure, you have to go for high potency. Bryonia is a subacute remedy. It requires a little bit repetition, very important. Effusion is the characteristic of the Bryonia. Bryonia is the remedy where there is effusion. It is the remedy which acts on serous membranes, and because of which the serous fluid which comes out, which produces effusion. We get more common effusion in Bryonia. Modalities, yes, definitely they are there, but the edema, the pitting edema, which you can see on the joint, is because of the serous effusion which happens to be there, and that is characteristic of Bryonia. So I know that this remedy was definitely used by earlier homeopath, but he never got the result because he has not considered the weight reduction factor. I asked the patient to go for weight reduction. Along with, I have asked all those exercises which I have already mentioned to you while explaining the first few things. That is, all those exercises I generally ask the patient to go for all those exercises because it helps a lot. It helps to settle down immediately the knee pain. Ask them to continue because these are called as non-weight bearing exercises where you are not putting weight on the joint, and once you never put a weight on the joint, it becomes free and it never causes damage. So these exercises I have asked the patient to go for along with the diet, strict diet, and I have given the same prescription, Bryonia along with 26. Patient was absolutely improved because during first month, she has reduced nearly about 5 kg of weight, and every month she has reduced 5 kg weight. She settled so nicely and recovered completely. So this is the importance of the homeopathic management. You have to think, you have to utilize logic, you have to consider what allopaths considers. Why do they explain all those things? There is one exercise which is called as the knee exercises. Especially, it is called as a quadriceps exercises. Patient should sit down on the chair and he should just stretch his knees, keep it for some time, again take it down. Again, he can do that. Because of which the hamstrings, the thigh muscles become strong. The weight which is going through the center now get transmitted to the muscles, and because of which there is much relief to the joint happens. This is the reason why it has been asked, and this works beautifully in such types of patient. So you must know all those things which helps your patient to come out of the situation. You handle such types of cases very nicely. So that this is the aspect which I want to share with all of you. Yes, this is called as the auxiliary line of treatment. And these auxiliary measures, once you understand the importance of auxiliary measures in your treatment, then definitely your homeopathic treatment becomes a homeopathic management, and which brings out the patients in a proper manner. So what we have learned today, we have learned the importance of auxiliary measures in the homeopathic treatment, making it to manage, handle the case in a nice manner. So that's all definitely helps in your day-to-day practice. So there are many people who have joined from abroad also. Thanks to everyone who have joined today's session. We'll meet again next Thursday, or probably next Thursday, with some new topic. But go through it. These videos I will going to upload tomorrow, so you can go through that again. And my suggestion to all of you, be a member of our school. Just paying 500 rupees for life membership, so that you can get lot of things on this YouTube. So this is your channel, the Divine School of Homeopathy. Go over there and go through the biochemics chapter, so that you can learn lot of things over there. So thank you being there, and thanks a lot to the Dr. Jayesh Shilsagar. Many teachers are there.
Thank you, sir.
Thank you, everyone. And we'll meet again whenever the time permits. Mostly in the uh, definitely on the Thursday, most probably. Yes, Kent's repertory I will going to take definitely, Raji. No, don't worry. I'll whenever time permits, I will definitely will be there with the Kent's repertory.
Thank you, sir.
So thank you. Good night to everyone.